Hi everyone, happy World Menstruation Day. My name is David Coulon. I am the Vanuatu National Washing School Coordinator. Um, we're just here to talk about challenges surrounding MHM in schools. So there's a lot of challenges in Vanuatu. It used to be a lot, a number with washing schools. Now we are reducing the number of challenges, and yet we're still facing some more. So some challenges are just like maybe non-understanding of what MHM is, because traditionally menstruation was considered as taboo, and it still is. But we're slowly taking the school community and trying to organize in such a way that the community would be drawing from the school practices to finally understand that menstruation is in fact just a biological cycle and part of human life. In this regard, to be girls to be respected, and a lot of education need to be provided to school communities, teachers, in the curriculum for boys, girls, men, women, and the whole society as a whole. Happy Menstruation Day.
Great, thank you, Kim. Evariste, over to you.
Thank you very much, and ending by a very nice music, right? Which is also the show that to tell us basically MHM Day is a very important one. And as we are going to celebrate the 28th of May next week, collectively we partner, we thought that might be very important to put a certain of series of webinar for the learning process as we go along and reach the D-Day. I'm very happy today that many of our colleagues of WaterAid has joined us, many familiar faces joined the webinar today, and also some of our colleagues in the regional office and many other sectors, Live, thanks for joining us again today, and also colleagues from DFAT as well joining this event. So as you all know, the MHM Menstrual Hygiene Day is a very important day. It's a sort of an annual awareness day that highlights the importance of menstrual hygiene management at a global level, and also the way it was initiated put more emphasis on how we can better advocate to hear the voice of girls, those those in menstruation period, as well as those who are basically inclined to do so. So for us, it's quite a good things that over the coming 2 and 3 days that we'll be having those kind of webinar, we dig into many aspects on how we can make better case and how we can basically advocate for menstrual hygiene management. Um, the 2021 theme of the day would be we need to step up action and investment in menstrual health and hygiene now. And UNICEF is part of this kind of deal, and also convening those webinars are very important in the way that you can learn totally different things from many other partners and put more emphasis on what will be the bigger challenges and how we can solve them as we go along. By starting today on 21st of May, this is only the first day that will address more how people who are left behind not having access to those kind of product or service or information related to menstrual hygiene. But and next week on Monday, we'll have more discussion on how we have the knowledge through digital information and also the skill that is needed to support these menstrual hygiene. And then we see Friday, next Friday probably, oh no, on 27th of May, we have the tool on how to accelerate action toward better investment in menstrual hygiene management at different levels. So before I just hand over back to Brooke, I just want to point out three main things for me that are very important as we continue and we start thinking on how we reach billions of people around the whole who still need those kind of services, so need to change to have those kind of awareness in terms of menstrual hygiene, and menstrual health as well. The first one is collectively we cannot achieve menstrual hygiene at a scale without a bigger partnership. I think it's not possible. So the government needs to be in, the civil society, but I just want to emphasize on how the private sector role will be key in developing the product and service to reach many people. I think it's very fundamental. The second aspect that I just want to emphasize on are those people who are in need, who don't have those kind of services, how we get service to them, how we get product and service and information to them, and also consider those people who have disabilities as well. Those are totally in need, and then we need to reach out to them. And the COVID pandemic has teach us basically that those are already marginalized before the COVID-19 situation will be also during and after. So we need to take care and to have a strategy on how we get those services to them. And then the last pieces for me, which is key and fundamental, is a part of having information, a part of having a better partnership, and how we make those services available. And the last piece I just want to emphasize on the inclusiveness of the action that we are taking, how collectively in a society, in a community, we can help those having those kind of challenge to be addressed. My daughter is more or less 13 years old, and they still have those kind of challenge of menstruation, and having taken care of those in my family give more sense to me on how I can handle as well the challenge of girls and women outside, and be caring about those kind of challenge as well. So I will thank you very much for coming and joining this webinar today. I hope the discussion presentation will be quite fruitful as we go along in the three main area of the webinar that will be coming up. Thank you very much, and happy to have you again on Monday, and also on 27 to have more discussion on knowledge and also on investment side. Thank you. Over to you, Brooke.
Great, thank you very much, Évariste, for that opening. And hi to everybody that's just joined us. So if I can ask my colleague Kim, he's just putting up the slides here. So the topic of our webinar today is indeed picking up on those points that Évariste mentioned about how we get access to people who are in need that don't have services or information right now. And really indeed talking and turning our attention to inclusion of people who might be marginalized or left behind. So on the next slide, we have just a couple of reminders about today's event. So as you're just joining this webinar, and I see there are a couple people just joining us now, please set your name in Zoom. So because we have people from so many different organizations on the line today, it would be helpful if you could rename yourself with your organization and at least your first name, so we know how to address you during the questions. If you're not a presenter, please mute your microphone and turn off your video. You can use the chat function to interact with presenters and put your questions and answers in the chat today. And if you have technical issues, you can just ask for tech support in the chat and somebody will assist you. Lastly, as a courtesy, we'd like to let you know that this meeting is being recorded. And if you choose to stay in the webinar, we will assume that you are consenting to the recording. Great, thank you, Kim. On the next slide, we have the agenda. Today, we're going to take a look back at some of the progress and achievements that reflect all of the incredible work that all of you are doing across the East Asia and Pacific region. And to do that, I'm really pleased to be joined by my colleague Chelsea Huggett at WaterAid Australia. After that, we will be hearing 3 presentations about different groups that are perhaps risking being left behind without further attention and action. And we want to learn from the challenges of these groups so that we can respond to their needs and indeed partner with them more effectively moving forward. So we're very pleased to have Chloe Morrison from World Vision Vanuatu, Sandrine Benjamin from UNICEF Vanuatu, and again, my colleague Chelsea Huggett from WaterAid Australia presenting on behalf of the work happening at country level. After that, we'll go into a panel discussion. So this is where we'll need all of your active contributions and your questions in that chat box so that we can have a good discussion with the presenters. And we'll also be joined by my colleague Live Saba from UNICEF, who is our program specialist for children with disabilities, working across all of our program sections. And in closing today, we're really happy to have Rosie Ween, the Chief Executive of WaterAid Australia, here, and looking forward to hearing from her at the end of the webinar. On the next slide, we'll move into the first part of the agenda, which is about providing an overview region on menstrual health and hygiene. So again, I'll start and then I'll hand over to Chelsea. Throughout the presentation, there's a lot that we are missing because this is a short presentation. So if there's something that you really think needs to be mentioned and some progress and achievements that you want to share, please put them in the chat box and we will be collecting everything that you put in there for the webinar minutes and report. So on the next slide, because this is a WASH webinar, we're going to start by looking at how access to WASH services have changed since the year 2000. So these are some graphs that some of you might be quite familiar with. As you can see, there's good data available on household WASH access to services, and there has been tremendous progress in the region. You can see these ladders on the left side is the year 2000 for households, and on the right side is the year 2017. So you can see that upward slope means that there's good progress being made. Yet despite this, there are still barriers to menstrual health and hygiene, of course. And we can only use this WASH access as a proxy. It's not everything, certainly. But even with the WASH access data, we can see that in 2017, 369 million people across the region lacked access to basic sanitation services at home to support menstrual hygiene. Now, coming to the right of the screen, you can see that there is some data on schools. There's no trend data. This is only 2019 data, but we hope to have it soon. And we know many of you have been working on filling these data gaps. But even just using school toilets as a proxy to access to supportive services for menstrual health and hygiene, we can see that there are 137 million school-aged children across the region that have no sanitation service at all. Assuming half of them are girls, this is around 68 million girls that are missing this service. On the next slide, I wanted to just briefly look back at this 2016 regional review. We know that WASH services alone are not sufficient to support menstrual health and hygiene. So by drawing on some of the findings from this regional review, hopefully we can have a more comprehensive picture of the progress and gaps across the region. This review was, it's called Supporting the Rights of Girls and Women Through Menstrual Hygiene Management in East Asia and the Pacific, Realities, Progress, and Opportunities. You can see it here on the right of your screen, and it was led by Dr. Sarah House. Now, what she found was that misconceptions about menstruation and about menstrual hygiene, combined with limited access to services, limited availability of sanitary pads or other menstrual hygiene materials, and inadequate teaching and learning opportunities about menstrual health and hygiene were barriers in this region. Yet at the same time, in 2016, there were many promising developments. So for instance, there was increased momentum for learning about MHM through studies and research that were happening across the region to help understand girls' experiences. And there was also increasing action by governments and practitioners to pilot practical responses, although many of them were still at a small scale in 2016. On the next slide, we can see some of the recommendations from this regional review. So these included things like developing regional guidance that would be able to help strengthen curriculum, research, and advocacy across the region, or working at the national level to strengthen policies, guidelines, and capacity through things like teacher training. And this is work that we know many of you are doing. Also, improving research was a recommendation, and M&E by integrating MHM in baseline surveys or national monitoring systems. Another recommendation was about improving access to services and facilities. So, WASH facilities to products and materials that could be supportive during menstruation. And also, lastly, an issue that cuts right across all of the recommendations was ensuring that women and girls are at the heart of, and indeed leading, solutions, particularly those from minority or marginalized groups that we're going to talk about today. So now you may be asking yourself, how far have we come on these recommendations, and what's happened now that we're in 2021 and this report was done 5 years ago? How much has the situation changed? So to give us an overview of progress in the region, I'm really pleased to introduce Chelsea Huggett. Chelsea is the technical lead for equity and inclusion at WaterAid Australia. And many of you may know her from her work across the region. She specialized in gender equality and disability inclusion and WASH programming in this region for the past 7 years at WaterAid. Chelsea, over to you.
Thanks, Brooke. And good afternoon, good morning, or good evening, everybody. My name's Chelsea. As Brooke said, she just gave me an introduction. Before I start, I just want to acknowledge the traditional owners of the land that I'm calling in on today, the land of the Tongarong people, and just to pay my respects to their elders, past, present, and emerging future leaders. So thanks, Brooke, for that fantastic overview to kick us off. And it's hard to believe it's been 5 years since UNICEF produced that report of the region. And if you've not looked at it yet, I think a lot of the rich findings in there are still really relevant and still provides a lot for us to continue to build off in the work that we do, particularly those recommendations. So what we'll do from here is to really then look at what has happened over the past 5 years and where have we seen increasing action and momentum, and where are there still some gaps. So we pulled together this really quick timeline, and to be honest, this is by no means a reflection of the whole region. So I can see lots of people here joining from the Philippines, from Indonesia, from Myanmar, and those are countries that have done a lot of work on menstrual health and hygiene. So my apologies that the top line of this, which shares some national level efforts, are mostly drawing from the Pacific, because a lot of the work we've been doing lately at WaterAid is really Pacific focused. So I was just drawing from there. But over the last 5 years, what we have seen across many national governments is an increase of menstrual health and hygiene and policy. So certainly WASH policies have been among some of the first policies to integrate menstrual health and hygiene. We're seeing that more and more around comprehensive sexuality curriculum, such as in Papua New Guinea, that was adopted last year. And I just put there a statement that the Fiji government produced last year on Menstrual Health Day, just to show some of the advocacy work and the kind of awareness raising that also happens, that may not be in policy, but is more that kind of soft side of system strengthening work that we do. I thought it was a really powerful quote, calling on people in the community as well as other ministries to do more on menstrual health. Then across the bottom there, we can see there's been a lot of work as well around regional level efforts. So things like the Water for Women Fund, which works across, I think, 14 countries or 14 NGOs doing menstrual health as part of that, the Pacific Trade Finance Vehicle, and the Menstrual Health Network. So we'll go into some of these in a bit more detail to really understand what does this project look like, what does this progress look like? So next slide. So we've categorized these into 4 or 5 key areas. So if we look back at where we were in 2016 around social support for menstrual health, some of the evidence that we saw and what the issues are that still remain huge challenges and huge barriers are things like poor hygiene practices, lots of behavioural restrictions around food or movement, so being able to go to church, that type of thing. So what that report in 2016 highlighted is we need more research to understand the taboos and the myths. We need to be able to address those misconceptions. So more attention was needed around norm shift and increasing advocacy through things like Menstrual Health and Hygiene Day. So just to flag that this has been an area that a lot of NGOs are working on, a lot of governments, and other organisations like UNICEF. And a quote from a teacher in Papua New Guinea who's been involved in developing their comprehensive sexuality education. Her words, there last year during an evaluation, she said, "I can see big changes in the children, the way they think, the way they tend to respect each other. So when a girl is having her period, it's normal." Next slide. We'll look at how we've gone on progress around knowledge and skills. So again, this is an example drawing on curriculum development work that we've seen. So the findings of that 2016 report really highlighted the gaps around knowledge and skills. One of the key findings there was that teachers don't feel equipped to teach students about menstruation or menstrual health and hygiene. So since 2016, I think we've got lots of really good examples of reaching girls and boys in schools, for example, in Indonesia, Mongolia, Timor-Leste, Papua New Guinea. And yeah, I think when I look at the last 5 years and having worked in this space for some time, probably the strongest area and where we're gaining the most traction is in school-based menstrual health and hygiene work. So the next topic on the next slide that we've looked back on is, as Brooke presented at the very start, is what progress have we made around facilities and services. So probably, as most of you know who work on menstrual health and hygiene, water, sanitation and hygiene is absolutely essential for menstrual health. And what we know as well is that when people menstruate, they menstruate everywhere, whether they're at work, at home, at school, in the community. So what we need to be thinking about with scaling our WASH work is making sure that institutional WASH is MHM friendly, and of course household level change as well. We don't have great data on this in the sense that our menstrual health and hygiene data uses school toilets as a proxy. So we can't actually look really at how we're progressing on that since 2016, although we're increasingly seeing WASH indicators used in EMIS systems. So on the next slide, there has been, if we then turn to another component of menstrual health and hygiene, which is around appropriate and affordable solutions or menstrual materials for people who menstruate to use to absorb blood in a way that's affordable, comfortable, culturally appropriate. We don't have any real regional data on this. However, there's lots of great formative research coming out at the country level. And we can really see much more growing attention to talking to people who menstruate about their preferences. So what type of materials do they use? And a shift in private or market-based solutions to this area. So lots of work around supporting small and micro enterprise organizations, which are often women-led. So we're seeing a women's empowerment angle coming through some of that work as well. So one example of this on the next slide, is called the Pacific Trade Finance Vehicle for Menstrual Health. So 2 years ago, the Pacific Rise Group started working with impact investors Red Hat and Lotus Impact to work together with Pacific-based small enterprises who were already making pads for them to get larger supplies of materials to reduce the cost to sell those pads. So they've organised for a whole lot of people or philanthropists to donate money, and out of that, they're using that to pool resources to lower the costs. So it's a really interesting model, really innovative. And next week, they're joining a webinar. I think it's the one on Monday afternoon, Brooke, or is it Thursday? Sorry. I think if you click through the slide, Thursday. If you click through the slide, it might say that, yeah, there's a webinar next Thursday where they'll present more of their work. That's the one. So on the next slide as well, another important component, or I guess many of us on the call are probably WASH actors. So while we recognise that menstrual health solutions require health, gender, education approaches, often it is WASH actors or WASH approaches that are leading some of that work at the regional level and at the country level. So interestingly, the Water for Women Fund are about to publish a report. They've reviewed across 14 projects what some of the menstrual health and hygiene approaches are. So just to share that slide quickly to show that the WASH sector is playing a really critical role throughout this region of ensuring that women and girls have got improved or better menstrual health and hygiene. And on the next slide, we also wanted to really highlight that a key part of improving menstrual health and hygiene in the region has actually been more at the macro level and thinking about that enabling environment, or the ecosystem that's needed of all those components to improve menstrual health. So we've seen a real shift in how organisations are coordinating together, sharing knowledge and information, really across the Pacific sub-region in particular, with things like the Pacific Menstrual Health Network starting up. It's still limited in some ways, in the sense that for any holistic menstrual health solution, it's absolutely critical that all of those sectors are involved. So sexual and reproductive health actors have got a role to play, WASH actors, gender actors. Bringing all of those together can be challenging, as we know. But in Timor and Papua New Guinea, over the last 3 years, WaterAid's been partnering with Mari Stopes to really bring that integrated WASH and SRHR practice together. So I think that's a good area to highlight, that there's continuing momentum around the importance of menstrual health in national policies, strategies and guidelines, which need to cut across different government ministries. So next slide. So that's a snapshot, I guess, of the whole region. And Brooke and I recognise that in pulling that together, we've given you sort of snippets of work that's happening, and it's not fully comprehensive. So we'd love to hear more about what else is happening. But that brings us to this really important question of who's being left behind. Are we really ensuring that we're reaching those who are most marginalised? So whether that's women and girls in different situations, whether that's people who menstruate, who may not identify as a woman or a girl, really thinking through all of the different people who are affected by menstrual health and hygiene. Just recently, a group of leading global menstrual health experts came together to really look at the definition of menstrual health. And I'd encourage everyone to look at this paper just to get a sense of how the approaches are evolving and shifting. It's quite a comprehensive definition, so we've not shared it here, but we just wanted to really flag that they've really thought through how and why we need to think about different factors and experiences that people have, which means that they menstruate differently, that it's not the same for every person who menstruates. So that was a whirlwind tour of the region. What I'll do now is invite Chloe to share with us some work that World Vision has been doing in Vanuatu. Just to say from the outset, we had lots of speakers lined up today who could speak more from firsthand experience, and the principle of nothing about us without us is really core to the work we're doing. But there's so many challenges in the region at the moment with COVID and field work and all kinds of stuff happening, and it was just really difficult. So just to say, on the next slide, you'll see we really wanted it to be about learning from challenges of menstruators. So we'll be presenting and sharing experiences of different voices and different people that we work with. So I'll invite Chloe. Chloe's from World Vision Vanuatu, and she's the Strategy and Program Quality Director. So Chloe does fantastic work and supports research and evidence and activities linked to the Water for Women program, and has led a fantastic study on disability, which we'll hear about now. So over to you, Chloe.
Thank you, Chelsea. And hi, everyone. As Chelsea mentioned, I'm presenting on behalf of World Vision Vanuatu, but our work in Vanuatu, particularly with people with disabilities, is largely led in partnership with two disability organisations who unfortunately couldn't join us today, Vanuatu Society for People with Disabilities and Vanuatu Disability People Promotion and Advocacy Association. So we all know that adequate access to water, sanitation and hygiene is essential for health and wellbeing. Yet for people with disabilities, people who experience incontinence and people who menstruate, they often experience unmet wash needs. And there's very little data and research about the gaps with this, as we've heard earlier. In 2019, World Vision Vanuatu, together with a host of other local and international partners, conducted a Water, Women and Disability study, primarily to look at this intersection. So to explore the experiences of women, people with disabilities, and with and without disabilities, and their access to wash, and also their experiences with menstruation, which is what I'll be sharing about today. And this research was funded by the Australian Government's Water for Women Fund, which Chelsea's already spoken about. Next slide, please. So it was mentioned before about cultural taboos and the need for more research into cultural taboos, and that's one of the things that our study looked at. And this quote here is illustrative of cultural taboos that were found across both provinces, across people with and without disabilities, and across urban and rural areas. And this quote's from a woman who is 38 years old with a disability. She has a sight impairment. And she said, "When a woman menstruates, she mustn't live with her husband because she is sick. She can cause the husband to be sick with asthma, or they might have a pot belly, or even get sick with intestinal gas. We women are different to men. This menstruation is a disease itself. That's why I had to come and sleep here by myself." And so this quote also highlights just how internalized these cultural taboos and beliefs are. And also we start to see the role of respect for men and perhaps some of the patriarchal societies that we see across the region play out here in these cultural taboos and beliefs. Next slide, please. So like I said, harmful menstrual beliefs and taboos were found to be prevalent in Vanuatu, as they are in many other countries, as well as across the Pacific. The most widespread belief across all participants, and like I said, it didn't matter if someone was from an urban or rural area, there was no difference in age, there was no difference if somebody had a disability or didn't, was that menstruating women and girls will kill crops if they touch them, and that as a result, they must not work in gardens or cook food, and they mustn't lift heavy objects. Many believe that they must collect their own water for bathing, drinking, and washing their reusable products, that they must wash their own menstrual product and use separate latrines and bathing shelters. And we did some unpacking about where did these beliefs come from? Why were they so pronounced? And the reasons for adhering to these beliefs were, like I mentioned before, respect for men. Women didn't want to make relatives ill, so hence not cooking. The belief, and that was really driven by a belief that when you menstruate that you're unclean. That it's written in the Bible, and that is quite relevant for the Pacific, where most countries are predominantly Christian. These were beliefs that had always been practiced and passed down through generations, which is also important when we consider key influences are often mothers or grandmothers. And then menstrual taboos are also internalized. Now, there was no difference in the beliefs across people with or without disability, but they impacted people differently. And that's what I'm going to share more about. So the impacts of these menstrual beliefs more negatively affected women and girls with a disability. Next slide, please. So the images above show 3 photo voice outputs from Litty. Litty is a female participant with a mobility limitation, and it highlights the layered difficulties that she experiences with menstruating, the implications of needing to travel far to the water source, inaccessible facilities, and difficulties washing for herself on her own. And you can very clearly see from these photographs how the socio-cultural beliefs surrounding menstruation that dictate that when menstruating, women must collect their own water for washing their menstrual material, bathing or drinking, impact people with disabilities more than those without. Now, the impact of menstruation and the taboos and beliefs on people with disability goes beyond just health and hygiene. Women and girls with disabilities were statistically nearly twice as likely than women without disabilities to miss out on social activities with menstruating, with 29% of people with disabilities reporting to miss out on social activities compared to 18% without, which is still almost 1 in 4 women without disabilities as well. So when we think about why it's so important to address menstrual health and hygiene, it goes beyond just wash, but it's also integral to when we think about education, economic empowerment, community participation and governance. Next slide, please. And supporting people with disabilities is not a one-size-fits-all approach. So Litty had a mobility impairment. This is a quote from a woman who was 42 years old who has both a mobility impairment but also self-care impairments and experiences incontinence. When I was just lying in bed, I really hated getting my period. And the first time I got my period whilst in this bad condition, it was so difficult because when I have my period, I don't like to wear panties because I'll make a mess. Who will take them off me? Who will pull them off me? And who will put them back on me? People with disabilities who are unable to manage their menstruation independently may require the support from support from carers, but it's also important to note that this will be dependent on different impairments that people face. And I think when we think about disabilities in WASH, so often we think about access to facilities, so ramps and infrastructure, but it's so much more than that when we consider different impairment types as well. Next slide, please. So what are some of the ways that we can improve menstrual health for people with disabilities? Like I said, it's not a one-size-fits-all approach and it needs to be tailored depending on impairment type, but also access to washes. We know difference between urban and rural areas. The role of men and boys in addressing cultural beliefs and taboos is really important when we consider having long-term lasting change. We need, particularly for this region, considering how disaster prone we are in the Asia Pacific region, we also need to consider the needs of menstrual health and hygiene needs for people with disabilities in humanitarian response, including tailored to different impairment types. So it's been pleasing over the past years to see menstrual health get more promotion and attention in emergency response, but that attention hasn't yet given way to exploring the needs of people with disabilities. Consider ways to support carers for those who are supporting people who can't manage independently. And then also increasing access to latrines, water points, bathing shelters, etc. can be really important to supporting people with disabilities to manage their menstruation with dignity. And that's all that I'll share for today. Next slide, please. But there are other ways to find out more. So like I said, the full study on this, there's so much more that we could share, but the full study is online. And there's also been a research paper recently published in the Lancet Journal of Western Pacific detailing more of the methods and approach to the research and some of the other key findings, particularly on disability. That's all from me. Thanks, Chelsea.
Thank you, Chloe, so much. This is really great to get a flavor of the experiences that that women were sharing with you through the study, and particularly having those photos to show from the Photo Voice project, I think is really powerful. So thanks, and I might just ask if you can pop those links into the chat box as well while we continue. We're gonna go straight through, and if anybody has any questions for Chloe, we will have time during the panel discussion for you to ask those. So go ahead and put them in the chat box now. Now, Chloe, one of the things that you mentioned was about the way that women with disabilities may be particularly affected also in humanitarian response. And for the next presentation, we're going to hear a little bit more about the needs of girls and women and the challenges that they face when they've been affected by an emergency. So I would like to introduce my colleague Sandrine Benjamin from UNICEF's Vanuatu field office, who will be talking to us about this. Unfortunately, she's in the field today without good access to internet, so she is not able to provide a live presentation, but we have a recording of her presentation on her work supporting emergency affected menstruators. Sandrine is a WASH officer with UNICEF, and her background is actually in biology. She studied at the University of Hawaii. And prior to joining UNICEF last year, she worked as the Health, WASH, and First Aid Coordinator, who was also the Protection, Gender, and Inclusion focal point at the Vanuatu Red Cross Society. So we're very pleased to have her voice today. And now my colleague Kim will play the video that we have from Sandrine. Over to you, Kim.
Hello everyone, my name is Sandra Benjamin. I worked as a WASH officer at Vanuatu UNICEF field office. Now, today I'd like to share some specific challenges that women and girls in Vanuatu face during TCRO in managing their menstruation, and what the National WASH Cluster is currently doing to fully include emitting considerations in its disaster preparedness program. I'd like to share my screen. Just give me one moment. Managing menstruation can be very challenging for girls and women in Vanuatu, especially in communities where societal taboos and secrecy and embarrassment around menstruation are common. As we all know, disaster and displacement context usually makes these challenges become worse for girls and women. During TCRO, some of the challenges were lack of access to sanitary materials, including underwear and MHM pad, because in the affected areas, most of the families lost their homes. So women and girls were taken to, they were in evacuation centers, and they lost most of their belongings. One of another challenges was lack of access to private or safe toilets and disposable options for use sanitary materials. Often in not all, but most of the evacuation centers, there's limited privacy for women to manage their menstruation and also safely dispose their sanitary or use sanitary pads. There's also a lack of access to soap, water, and private bathing facilities and places to dry reusable sanitary materials, and that reduce their privacy and dignity, especially in overcrowded and temporary and transit settings. So emission is one of the big challenges, especially for women in Vanuatu during any emergency situation. Now, what are some of the way forward for the National WASH Cluster? So based on DC Harold lesson learned on the challenges and critical needs to address MHM, the WASH Cluster through partnership with Engineers Without Border are currently developing a sanitation and hygiene in emergency guideline, which was lacking during DCRO. So the guideline includes considerations for MHMs during assessment, during distribution. There's also inclusion of MHM awareness for both women and men, and also consideration for MHM during designs and construction of latrines and bathroom together for MHM needs. Now, also as part of the preparedness, the WASH Cluster in partnership with its partners such as Ministry of Health, its Ministry of Education, through its Wash in School program. And other partners are currently integrating emerging into the existing developmental WASH programs and raising awareness to break societal taboos around emerging in both schools and community. Last but not the least, WASH cluster is currently conducting WASH SOP training that includes a session on emerging for all WASH emergency response team, which includes the Department of Water Resources and Ministry of Health staff and NGO member partners as part of its disaster preparedness. Thank you.
Great, thanks very much to Sandrine for taking the time to record this video to share with us, giving voice to the challenges that women and girls were facing after Tropical Cyclone Harold in Vanuatu. I noted some of the things that she said about losing belongings, usual access to wash facilities or materials, as well as lack of privacy due to being displaced. And some of the good practices about the WASH cluster pushing for all policies and guidelines to specifically recognize and give voice and consideration to issues of MHM in emergency response. So thanks to Sandrine for that. I apologize that we won't be able to take any questions for her, but I know many of you on the call have long experience in emergencies, so hope that you can share more of your experiences in the chat. The next topic that we wanted to touch on today, and I'll ask him if he can bring the PowerPoint presentation back up, is issues affecting sexual and gender minorities. So first I want to say, as Chelsea said earlier on, there are many rights groups across the East Asian Pacific region that are doing important work in this area. And we really do apologize that we were not able to bring to let you hear directly from them today due to so many competing priorities and issues that I'm sure you're all aware of. However, I'm really pleased to introduce Chelsea to give us a brief overview of issues for trans menstruators. So Chelsea, over to you.
Thanks, Brooke. Yeah, so we really wanted to highlight, I guess, how we think about more gender diversity or sexual orientation diversity within our menstrual health solutions. So it's quite a new area for the WASH sector, but there's some really great emerging practice. So I'd encourage everyone to reach out and think about it and go and talk to rights groups who are advocating for inclusion in this area. So for people who menstruate who may not identify as a woman or a girl, they really experience a lot of marginalization and exclusion, huge discrimination in their daily life. And that goes right through to violence. And that can prevent them from accessing the most basic human rights services such as water and sanitation. Often people may lack legal recognition about their identity in their country. And there isn't a whole lot of data available around experiences or access to essential services or kind of the representation within the broader population. So some estimates range sort of up to just over 1% or 1.5%, but it's predicted to be higher than that. So things like accessing a toilet when you're in a public space, there not being gender non-binary toilets available, so toilets being for men or for women, not having infrastructure or services in terms of at school or at work or in the community, and not having access to information about menstrual health and hygiene. So for WaterAid, this is an area we've been starting to work on slowly, taking a do no harm approach since about 2018. And in Timor-Leste a couple of years ago, we led a series of WASH consultations with a range of rights groups from the LGBTQI community. And it was a really powerful experience. And one of the groups we met were a group of trans men activists. And when we raised the topic of how do you manage menstruation, it was a deeply challenging topic for people to talk about, because for them menstruation was a reminder of their biological sex. There were really practical issues that they shared with us around things like in wearing underwear designed for men, there was nowhere for them to put, you couldn't put pads properly in that underwear. Talking about how many of them had left school early, and school is obviously where we target a lot of our menstrual health and hygiene work, and particularly, comprehensive sexuality education often happens quite late in high school. So a lot of the people we were meeting had missed out on any kind of education about sexuality, sexual and reproductive health, menstrual health and hygiene. So on the next slide, there's a few examples, I guess, of ways that WASH and menstrual health approaches can be more inclusive and really more supportive of transgender rights movements. So one of the first things that we started doing as part of our scoping in Timor was to check on what terminology those rights groups were advocating for in their advocacy efforts, and adopting that. We started integrating sexual and gender minority awareness sessions as part of our gender work with government. I think always meeting with and talking to those rights groups will really help steer what menstrual health actors can be doing to be more inclusive, but it has to be done in a really safe way. So a lot of people identifying as transgender in many cultures, probably everywhere in the world, discrimination, violence, that their identity, that's hugely risky. And so we need to be really doing this really safely and taking their advice about what's the best approach. And also just making sure we don't do further stigmatization. So also working alongside other sectors like health and education, who are often also looking at how to do more LGBTQI inclusion work. Yeah, there are other examples, particularly from South Asia as well. So India, Nepal, WASH actors have been doing some work on transgender inclusion as well. Back over to you, Brooke, or am I doing the next? I can't remember.
Great, thanks, Chelsea. I think I froze for a second there, as always happens just when you're about to present. So I think, Kim, we can skip 2 slides forward. Thank you very much for managing the slides today. And now we're going to move to the next part of our program, which is the panel discussion. And I'll take any questions that you are putting in the chat box in this section. So in addition to our presenters, I'm really pleased to have my colleague Live, who I spoke about in the introduction, joining us today. Live is our regional disability specialist with UNICEF's regional office in East Asia and the Pacific. And her work here involves working with all of us really to mainstream disability across our policies and programs. And in addition, I really just wanted to point out that she was the global coordinator for the DFAT funded program on rights, education, and protection for children with disabilities from 2012 to 2020. And her background is as an occupational therapist. She started working as an occupational therapist in her home country of Belgium, which is obviously very, very relevant background for the discussion today. So thanks, and maybe I can ask Chloe, Live, and Chelsea to all keep your cameras on as we go through the panel discussion. So now I'd like to shift from highlighting some of these challenges to talking a little bit more about the solutions. So I'm going to start with Live and ask Live if she can talk to us about some of the good practices that you've seen in ways of creating more inclusive programming and addressing challenges and needs, maybe specific to children with disabilities. Over to you, Live.
Thank you very much, Brooke. Hello, colleagues. Great that you're joining in this very interesting webinar. Also very interesting for me. I wasn't aware of the in-depth research that had taken place in Vanuatu. I'm very pleased to hear actually some best practices from that region, because the best practices that I've seen are very few in number. And if I want to talk about best practices today, I think I have to talk about elements of best practices that I've seen in WASH and menstrual hygiene and health programs, but I can't necessarily pin down like one perfect total MHH program. Anyhow, we have heard from the research how vulnerable girls with disabilities, women with disabilities are they are facing multiple deprivations, also a complexity of stigma, because first of all, they're girls or women, and then on top of it, they have a disability, and that also often means that they are amongst the poorest in the society. When it comes to best practices and how we can leave no one behind, I would like to focus on 3 areas. One is the area of communication, the other is the area of physical accessibility, and then also collaboration. In the area of communication, best practices that I have seen on menstrual hygiene and health is about inclusion of images of girls with disabilities just in the mainstream communication, in the leaflets, in the guidance documents. It doesn't need to specifically be a document about disability, but just showing that girls with disabilities are part of the community or the society. And actually that also breaks down some stigma or taboo about the fact that yes, girls with disabilities also menstruate. Yeah, they also have a reproductive body that can reproduce. So because that is often not thought about, girls with disabilities are not always seen as having a normal functioning body. The accessibility of the communication is also extremely important. And then it's not just about, for example, having sign language on a video, but also thinking about girls with intellectual disabilities. We've heard from Chloe and from Chelsea, the vulnerability of girls with intellectual disabilities. If they menstruate, they may not understand what's happening, but also in general, I mean, they may need support from carers when they menstruate, and we also need to make sure that they are safe when they are receiving support when it comes to menstruation. They are at high risk of abuse. In general, we know that 80% of girls, 67% of girls with intellectual disability are at risk of having being harassed before the age of 18. Yeah? So in the communication, think about accessible material for girls with intellectual disability. Not just girls, I would say also boys, we need to involve them as well in the menstrual hygiene and health. Yeah? And then we talk about easy to read or documents with a lot of pictures and illustrations. Yeah? And a last group to include in the communication that's often left behind is the carers of people with disabilities, of girls with disabilities. So that's the aspect of communication. Moving to physical accessibility. If I ask you to type one word about physical accessibility, go ahead. What's your word that you would type if you think about physical accessibility for girls with disabilities? Ah, I see already. That's
Surely
the word I had in mind that probably everybody has in mind. A ramp. But we need to think beyond the ramp. Yeah, it's good if we think about the ramp, and it's good if the ramp, because I've seen bad examples as well, that the slope of the ramp is the right one, not too high. Yeah, but a ramp is what we have in mind when we think about physical accessibility. I'm challenging you to think beyond the ramp. Yeah, also think about how to calculate space in the restroom or in a wash facility where a person in a wheelchair can maneuver. Yeah, also the access exactly to the hand washing facilities. How is the tap to be opened for somebody that has, let's say, arthrosis or has a difficult hand function? How can they turn the tap? There's many aspects, and I would recommend, and I've seen also programs where a simple checklist can do wonders. Yeah, a checklist about the width of the door, a checklist about certain types of taps, and also what's the inclination of a ramp, for example. Yeah, and also to foresee a feedback mechanism for your menstrual health and hygiene program, a feedback mechanism that is also accessible for people with disabilities. You want to monitor, you want to know how your program is used, and you don't understand why the participation of people with disabilities is low. Well, but you need to also learn and get the feedback mechanisms, and therefore these also need to be accessible. My third point of best practices is around collaboration. WASH is one sector, but this is a sector that cannot function alone, definitely not in the menstrual hygiene and health. When it comes to disability, many girls with disabilities are out of school. If your menstrual hygiene project runs through schools, you will miss out on 50% of girls with disabilities. So one option is also to collaborate with special schools and eventually pilot some of the projects on communication and on accessibility in special schools if they are present in the country. Sometimes they're called special schools, sometimes it's a segregation, it's like a social protection center or a social welfare center that also educates children with disabilities. So we need to have collaboration there as well. But try to identify the girls that are out of school and how to collaborate with the structures under which they are housed. Then a very important partner in your collaboration, I know in the Pacific this has been strong, is with the organizations of people with disabilities, the OPDs. In the Convention on the Rights of People with Disabilities, there is a principle of meaningful participation. So very important is to involve OPDs from the start of your design. When you design your program, they have to be there, and there needs to be consultation and meaningful participation and engagement with OPDs. And then throughout the design, the implementation, but also monitoring, evaluation. And so this is throughout that there needs to be collaboration. I'm gonna stick to that for my first intervention, and I hope to come back, but also hear from other panelists on other best practices. Thanks.
Great, thank you so much, Libe. I have so many notes here and little scribbles in the margin of my notebook. So really practical, really fantastic tips. Now, Chloe, you had two questions in the chat box from the audience. So one from Sutalak asking, in the long term, does the education sector have plans to address the cultural taboos that you discovered through school curriculum? And I see that you'd also responded to a question from Belinda at Mama's Life in Vanuatu about what some of the next steps for your work are. So I wondered if you could respond to that question, and if there was anything from what you put in the chat box that you wanted to highlight. Over to you.
Sure, thanks, Brooke. It's actually a shame that Sandrine isn't here to answer that question about the education sector, because UNICEF in Vanuatu have actually been the real leaders in washing schools in that space and doing some great work there. So I don't feel confident in talking about formal plans, but what I will highlight is that throughout the research, what we found was that teachers very much didn't feel, and this was reiterated by Chelsea, didn't feel confident talking about menstruation. And part of that was because they'd never received that training. And I think there is a risk, I guess, just on that, speaking about teachers or nurses even, or aid health post workers, sorry, or even your own organizational staff, understanding that they might have some of these taboos and beliefs as well, or never experienced any formal training if it's never been part of the school curriculum. And so the importance of training in that area, but I can't speak specifically to any plans, unfortunately. But UNICEF Vanuatu colleagues, I'm sure, will know the answer to that.
Okay.
And then in terms of, Belinda asked about what the next steps are, and it's very easy when you do a big research project, I think, like ours, and it was qualitative to cover the menstrual health part, but the quantitative part covered about 55,000 people. It was a huge, there's so much research and data there. What it really did highlight to us, though, as Levi was just explaining, was just the vulnerabilities that people with disabilities face in all aspects of WASH. So as menstruation, I've highlighted today, incontinence, which is another sensitive, underrepresented and under-researched and under-implemented area, access to water and sanitation facilities as well. So the next step for us was really building around how do we reach the most vulnerable and improve their access to WASH. One of that is developing a carers curriculum that has a menstruation component, but also looking at incontinence, WASH, supporting people with with access and care and dignity, and supporting them with knowledge and understanding as well. So that's probably the next big bit. Like everything delayed by COVID, and then as Sandrine said, Vanuatu also had Tropical Cyclone Harold last year, so it's a bit late, but that's the big part that we're working on now. And Belinda's just shared as well, of course, some of the work that Mama's Life is doing in Vanuatu with schools as well, in the chat also.
Great. Thank you very much, Chloe. I think we're in the interest of time. What I'm going to do is ask Live one more question, and then I'm going to ask everybody. So perhaps Chloe and Chelsea, you can also be thinking about your kind of last word or your final message and take home for everybody here today, like if we had to do one thing differently. First, I'm going to ask Live if she can talk a little bit about changes from what you've seen in all of the work that you do with children with disabilities. What changes do you think are needed to the way that support organizations like all of ours, the governments that we work with, and WASH service providers, what changes are needed to the way that we work to truly reach everyone? Live, I don't hear you. Can Chelsea or Chloe?
Yes, sorry, there was another button to unmute. I did one, but apparently there was a second one. So regarding changes can only be achieved if we have all actors working on it, and all actors, you've listed them. We have governmental actors, and then we have support organizations like World Vision, WaterAid, but then also UNICEF, and then the organizations that are really on the ground there as service providers. When it comes to people with disabilities, I would say at government level, it's looking at certain policies that need to be put in place. Policies that can have to do with, let's say, the national standard of WASH facilities that needs to have universal design, but also policies, let's think about girls with disabilities that are forced, that have to undergo forced sterilization, because this is sometimes a way that in institutions they want to manage menstruation. So there needs to be also policies around that. Then the overall principle to advance the rights of people with disabilities so with a larger group and a larger scope should be to mainstream. So with universal design, we can mainstream them in our programming. And then, as Chloe and Chelsea have mentioned, some targeted efforts are required as well. And I would focus these targeted efforts in the first place on research and data collection. With the evidence, we can then further influence policies and inform, for example, our communications, our monitoring and feedback mechanisms. Yeah. The value of the service providers is also that they have a close connection with the communities, as I'm seeing in Mama's Life, the illustrations that are given to working with men in community, with teachers in schools. Yeah, so we are working in communities. Let's think in the communities also, if we gather people, is it in an accessible venue? If we invite women's groups, some countries have structured women's unions, yeah, or youth groups. Do these youth groups, do these women groups include people with disabilities, or is it usually, are they segregated? So these are all things to think about. If you want me to come to my last piece of advice, I'm coming back to my ramp, but think about the ramp as RAMP. R for research and data disaggregation. A for accessibility, accessible communications, venues, services. M for mainstreaming from the design phase all the way through in the implementation and in the evaluation, and P for partnership. So you can think about the ramp, but think about the ramp differently.
Fantastic. Thank you so much, Live. So now we can all take that ramp home with us and keep that ramp in our minds. Chelsea, over to you for your final takeaway or advice to everybody today.
Thank you, Live. I'm definitely using that. That was beautiful. I've never heard that before. Well done.
I've just invented that last night, but
that's so good. That's wonderful. Really good. It's a really lovely note to end on. I guess my final key takeaway would be going back to the nothing about us without us mantra that the disability rights movement really captured and has utilized that, but it can apply to any person experiencing marginalization. So I'm a huge advocate for disability inclusion, but also thinking about marginalization based on any factor, whether that's sexual and gender orientation, where a person lives, their income, anything. So yeah, nothing about us without us, talking to people and listening to their solutions. Thank you for today. It's been really great.
Thank you very much, Chelsea. And Chloe, your final takeaway.
I think there's so many interesting pieces in this sector, and one of them is just how pleasing it is to see the Pacific so strongly represented in this discussion as well. I think one thing that gives me is a lot of hope. The Pacific has some incredibly strong taboos and cultural beliefs and barriers and a whole range of areas that make this really challenging. But what I think gives me hope in this, and it's not just Chelsea and I have presented today on the work we're doing, but a whole range of people, just how possible it is, and that working together we can actually start to move this along before something that we talk about is kind of an add-on to WASH to something that's really core to all WASH programs that we do.
Great, thank you very much, Chloe. So we have Live's ramp, which resonates so much with all of the WASH people on the call today. Nothing about us without us, and this idea that it's a better world is possible, and it's possible to center the experiences of all marginalized people, but specifically people with disabilities in every aspect of our programming rather than being an add-on. Thank you very much to all three of our panelists. I'll ask him if he can put the slides back up, and I'll try to figure out how to remove our spotlights here, though I'm not super adept at using Zoom. So on the next slide, I think we have just a couple of key points, which I won't go over. We will include a slide here also on this great other project from WaterAid about disability inclusion in the notes for all of you. On the next slide, we have a couple of key summary points and takeaways that the panelists already made beautifully, so I won't spend more time on that. And on the next slide here, it's my absolute pleasure today to introduce for our closing remarks, Rosie Ween. Rosie, who some of you may know, is the Chief Executive of WaterAid Australia. Rosie has worked with WaterAid Australia since its inception in 2004. And prior to becoming the Chief Executive, Rosie was the Director of International Programs at WaterAid Australia, where she led a large team of people and programs in countries all across the East Asia and Pacific region. So Rosie, it's really a pleasure to have you here today, and over to you.
Thank you so much, Brooke. It is such a pleasure to be joining you all. And actually, I've been thinking as I was listening to how you introduced me there, Brooke, what my period bio, my menstrual bio would be, seeing as we're celebrating Menstrual Hygiene Day. And I was thinking it would be something like, I've been menstruating for 37 years. I'm heading into perimenopause. Thanks to my 4.5 kilo baby, my second baby, I suffer periodic incontinence, especially when I'm trying to play soccer or jumping around a lot. And what today has really given me is another moment to pause and reflect on the privilege that I have with my experience of menstruation. My experience of incontinence is the privilege I have of access to facilities, whether I'm at a school or at work or at home, the privilege I have of access to financing to get good quality products, the privilege I have of the education that I've had, my children and my family have had around taboos, so I don't feel that sense of taboo, and so many other privileges. So I really want to thank all of the panelists for the conversation today, and the importance, I think, of these days like Menstrual Hygiene Day is that it's a day for us to pause, reflect, learn together, to connect, but also to really commit, and to commit to action, as the theme is today. As I reflect on that, I would really like to pause and thank UNICEF and the team, Everest and Brooke in particular, for your incredible leadership and work on this, and everybody else in the UNICEF team working together with the WaterAid team, bringing this fantastic webinar together. I'd like to also just reflect on all of you as I was looking in the chat box and looking at the names that were there. I mean, when I saw some of the organizations and the types of work that you do, I could see that we had people from a range of different NGOs, government. We've got Vatim from the government in Cambodia. We've got people from WHO, from universities, the private sector, Grace teaching in the Philippines. And then the geographic spread that we've got from Cambodia, across the Pacific, Myanmar. I think I saw someone there from Angola, Denmark, Indonesia, the Philippines, and I'm sure I've missed other places in the world. This is what this day is about, coming together to connect and reflect, but it's also about learning. And I'd like to just thank again all of the panelists, hearing from Brooke the realities and the statistics on WASH and menstrual hygiene that we heard about. And then Chelsea reminding us of some of the momentum that's been gained, and for us to really be thinking about who's been left behind. And I think, Chelsea, you really got me thinking about those different factors for different people as to why they're being left behind, which Chloe really emphasized, I think, for all of us, how the context, different disabilities and impairments that people face really impact them differently. And I, Chloe, hadn't thought about self-care. And for you sharing that video, the photos, sorry, of Liti and the impact of her impairment on self-care when she's managing her menstruation was really powerful. And I'm really going to think about that more. And then to have the video from Sandrine, getting us to really think about the overlay then of crisis and what the reality is for so many people of losing their belongings and how they manage their menstruation. And Chelsea, bringing to life that work again from Timor, thinking about people that are transgender and menstruating and the impacts that has on them. So there's been so much for us to learn and take away from this. And I hope that as we're all in this period of time, which I think in all of our lives and our work, we can feel quite caught up in the doing. It's so important that we do pause and reflect and think about how in our work, our assumptions and our thinking, we are missing some areas, some people that are being left behind. And today has been a day for me where I've really been challenged to think about that, but not just think about it, challenged to act. So I really hope that all of you, like me, are thinking about, well, it's time for action. What action are you committing to? We've just heard some fantastic examples from Chloe and from Chelsea, and of course, just now from Leave, your fantastic ramp. I know for me, I'm going to keep thinking about what it is at WaterAid, how we can lead and think and work in a way where we're really focusing on those that are being left behind in our work. And personally, for me, I'm going to think more and learn more about the impacts around self-care for people with different impairments. So thanks once again for everyone for joining, for the organisers, for the incredible work and the fabulous panelists, and for all of you for joining this day for us to pause, reflect, learn, connect together, but most importantly, for all of us to commit to action. Thanks, Brooke, and thanks, everybody.
Thank you so much, Rosie. This is the absolute perfect ending to the webinar. So thank you so much for this inspirational call to challenge our own assumptions and commit to new actions for more inclusive work, and specifically today on menstrual health and hygiene. And I also really want to thank you and your whole team for the collaboration on this day and just continuing collaboration in the region. It's really a pleasure. So with that, I'm going to ask my colleague Kim if he can also bring the final slide back up. And while he's doing that, it seems like a perfect time to thank our behind the scenes team today. Without them, the webinar wouldn't have happened. So huge thanks to Maria, Dolores, to Maud, and to Kim for making this webinar happen today. If you like today's webinar, please register for the next two that are coming up, and we will send you all I put the flyer with the registration link in the chat box, but we'll send it to you as a follow-up from this webinar. We hope that you can tell your friends and bring them, or your colleagues, bring them all to the next two webinars. The next one on Monday is going to talk about the challenges and opportunities of the COVID pandemic with a spotlight on digital platforms such as Aki, the period tracker app. On Thursday, we're going to talk about action and investment, learning from new programming models and other investment opportunities, as Chelsea mentioned. And we're also going to have a special youth entrepreneurship panel, as Every said, so we hope that you'll join us. So with that, I will close the webinar for today. Thank you very much again for joining us, and we look forward to circulating the presentation, the minutes, and the notes as a follow-up. Thank you.